What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? Today we are going back to basics and we're going to decon, but we're going to decon with a stir the pot twist, guys. I've been trying to get my hands on a orthopedic set. I don't care who the manufacturer is, really, as long as the IFU matches what I'm trying to bring to light in this video. But this is the best I can do right now, and unfortunately this set right here has other issues that's going on with it that I can talk about, but I want to speak specifically to the IFU of this tray right here. So this tray is used in the OR, and it makes its way down to decontamination. So depending on, of course, you want to check when it comes to decon, you want to check that indicators are removed. So if the set wasn't used, you might see the indicator back in there. So this set had an indicator in it. I want to get this indicator out. Please ignore that sticker. That sticker is covering the hose there, which it shouldn't, so I didn't have the time to take that off. But y'all can talk about that in the comment section. But anyway, guys, this set comes down, okay? And it wasn't used, but it was in the room with the patient. So we have to process as if it was contaminated. Now, these are implants. And again, I can make a separate video about this, but I'm not going to talk no more about that. But let's talk about how we're supposed to clean this tray. We are to rinse this tray. We are to soak this tray. We are to final rinse it with treated water. And then we're supposed to go on to next processes. But what most individuals do is, because this tray contains implants or plates or whatever of this sort, it's very risky to place this into, and this is a small one. This is a small set, not so risky, but this is a small set. So it's pretty risky to rinse this off without having these pieces blow out of here and fall all over the place and potentially lose it. It's also risky to ultrasonic this tray as such, because again, items may float and get lost in the bottom of the ultrasonic. And same thing in the washer. So what we'll see most facilities do is they'll keep this plate on top. They'll do a rinse under running water. Instead of spraying, they'll do running water rinse. And then when they soak, they'll soak with the lid on. Do a final rinse. They'll probably take it off and give a final rinse under running water. If they have a sprayer, then they'll rinse as such, place in the ultrasonic as such, and place in the washer as such. The stir the pot motion on this is correcting that process. When this instrument comes down, when this set comes down to decontamination, whether it was used or not used, it should be pre-treated. Okay? If we're truly following the IFUs, the IFU of this instrument tray states that cleaning must take place outside of the original sterilization container. This is the sterilization container. Okay? So if this is the only set that gets wrapped, this is the sterilization container. So how are we doing that? What does that look like? Well, if we have a separate basket, we are to take our instruments out of the original container. As such. Okay? This container gets cleaned separately and it may be soaked as such. These instruments get soaked as such. Rinse it, soak it as such. Okay? During the rinsing process, if there's gross soil, okay, we remove the gross soil with a soft bristle brush, making sure to remove all gross soil from every item individually. If that is the case, if we see gross soil, Okay, after the soaking process, whatever the soaking process is, last I checked, the soaking time is 15 minutes for this tray. So we soak for 15 minutes, then we remove everything to the final rinsing sink, and then we do a final rinse with deionized or reverse osmosis water. Okay. From there, if the tray can go into the ultrasonic, it goes into the ultrasonic. And last I checked, we are ultrasonicing this tray for 20 minutes. 20 minutes of ultrasonic, and then into the washer disinfector under the ortho or loaner cycle, which does not contain lubrication. Okay. This is the proper way to process this tray. We have to remove all the items out of the original container into a perforated bottom container to be cleaned properly. That is a must, not a should. Okay. I wish I had a more complex tray because this one was easy to do. This is feasible and this is doable. But for some of the complex systems that have over 768 instruments in the set, how do you accomplish that? How do you accomplish sets that have screws? Again, when we talk about implants, it's a whole different ballgame. But even instrumentation such as drills, depth gauges, drill guides, and other instrumentation, bone clamps, periosteal elevators, so forth and so forth, and that contain 4 individual containers such as this with other plates and instrumentation. How do you manage that and be able to send that over to the prep and pack side so that assembly can take place properly? This is the process that is outlined in the IFU. This is the process that I have yet to see practiced in any facility. If you're doing this process in your facility, please comment as to how you're managing this process and if this process is doable. Is it conducted by one individual, several individuals? How long does it take you to properly process a tray that tells you that the original instrumentation must be removed from the original container? All right, guys, as always, stay true to yourselves. Keep it 100. Continue educating yourself, and peace.